Hello all, this is Dr. Shilpi Reddy, Head of the Department, KIMS Cuddles Mother and Child Center, Kondapur, Hyderabad. Today we are going to talk about yoga in pregnancy. Yes, yoga not only in your normal daily life, it is also very beneficial for pregnant women, and its beneficial effects extend all throughout pregnancy and childbirth. Even after childbirth, yoga helps better healing and coming back to normal. So, we're going to talk about yoga in pregnancy today. What is yoga? It is not only about cyclical exchange of breathing and exercises. Yoga is about relaxation. The amount of relaxation that comes with yoga is really important. So in pregnancy, what are the effects of yoga and what type of yoga is beneficial in pregnancy? We'll talk about it. As an obstetrician, I have definitely seen a lot of benefits of yoga during pregnancy, and it is really beneficial to do yoga during pregnancy. We usually start yoga from the second trimester onwards in terms of stretches and asanas. In the first trimester, we concentrate more on breathing exercises, the pranayama, the Bhramari pranayama, to improve oxygenation and to get stability in your body because of coming up hormonal changes. Once the second trimester starts in, we have certain exercises, certain stretches, certain poses that help pregnant women. Talking about yoga in pregnancy, there are several various forms of yoga, various forms of exercises, various forms of asanas that are there in yoga. But yes, simple forms of exercises like the cat-cow, like the balancing table pose, like the downward facing dog pose, the goddess pose, the bound angle pose, the butterfly squats, and the parvatasana. These are certain poses and stretches in yoga that really help pregnant women deal with pregnancy and also the tension that comes into their muscles and the relaxation that it gives. Pregnancy, there is a difficulty in balancing in pregnancy. So any poses that affects the balance of the body, especially when the center of gravity shifts and there is a belly that is there, and all asanas which are putting pressure on the belly, especially when the belly is upside down, and all these asanas are little difficult to do. Not only they are difficult, but there are chances of accidents also. So asanas which are easy to do, which are safe during pregnancy, are to be done, and especially asanas that put pressure on the abdomen and pregnancy and impact the balance of the body, and the chances of fall is there. So these asanas have to be done under supervision or not to be done specifically when you are alone in the house. So yoga is all about safety and its health benefits. So definitely do not try something new which can harm you in any way. At Cuddles, we have yoga classes on a regular basis. So in the first trimester, whenever the pregnant woman comes to us and she gets booked in her first checkup, we ask her for all the investigations and we introduce her to breathing exercises, especially the pranayama. When she gets introduced to pranayama and she starts doing pranayama for about 15 to 20 minutes in the beginning, and similarly there are various forms of pranayama like Bhramari pranayama and all these, which improve oxygenation in the body, which create a sense of well-being and also decrease nausea feeling, and they also have beneficial effects on the various hormonal changes that come through pregnancy. and also benefits in stabilizing her mental status and give a lot of relaxation and well-being feeling. So once she is introduced to pranayama, and then we ask them to do regular walking morning and evening. Once she is comfortable and stabilized, then we slowly start introducing the asanas, as I have told you, in the second trimester. Once the NT scan is done, then they are scheduled into weekly yoga classes, and the yoga teacher takes them through the yoga, which is specifically done in pregnancy, and also certain amount of changes are done, especially when they have localized problems like backache or leg pains or neck pain or shoulder pains or muscle cramps and aches and catches. So the person in charge, we have 2 to 3 people in charge of yoga in pregnancy. We have a Lama's childbirth education specialist, we have a physiotherapist and a yoga specialist. So these people, through their expertise, take the pregnant woman through yoga and also focal problems if they in case have. So it is all about a combined effort, and definitely yoga in pregnancy not only helps in relaxation, not only helps in improved blood supply, it improves flexibility of the body, it improves muscle strength, it improves blood circulation, and overall the effects are so promising that most of them who go through yoga have a normal vaginal delivery. There are a lot of apprehensions that pregnant women go through. This is one of the apprehension, which is really a false apprehension, because yoga does not cause miscarriage in any way. And to be very frank, in the first trimester, we start off with the regular pranayama, which improves oxygenation and which in fact works against a miscarriage. So there are a lot of studies, and I have seen in my practice that how yoga improves the pregnancy rates in infertile women, and also how yoga improves the implantation rates and blood supply to the endometrium. And there are n number of cases that who have conceived, who have had recurrent pregnancy loss and conceived after good lifestyle modifications, introduction of yoga, exercises, and additional therapy that is required for the problem that they are facing. So yoga never ever causes miscarriage, and especially these days women are so into yoga that everybody who's planning pregnancy, they start off with the yoga before planning pregnancy, and all throughout pregnancy they go through the same yoga, especially adding on to the new poses and beneficial poses during pregnancy. They have absolutely no complaints, and this is really a misconception. People who have already been doing yoga and practicing yoga, attending regular yoga classes, and who have been on yoga exercises from a very long time or pre-pregnancy planning itself, they can as well continue their yoga exercises all throughout first trimester and pregnancy. And people who are just getting introduced to yoga in early pregnancy, yes, they start off with the smaller exercises or the smaller poses, and then practice starts with pranayama, and then slowly we introduce poses like cat camel, we introduce poses like butterfly, we introduce poses like downward facing dog, all these things. So depending on the trimester wise, depending on the requirement that pregnant woman has and isolated problems that they are having, these poses are slowly introduced by a yoga specialist, and it goes slowly. So suddenly you just can't introduce 10 poses in a day or two or in a week. So that will be too much. So definitely we start with the pranayama and then take slowly through the first trimester, and that is also the way to start yoga for people who are new to it. So definitely it takes time and it is introduced slowly. as I have told you, there are about 5 good poses that you can practice yoga during pregnancy. That is the cat cow, that is the balancing table pose, the butterfly, the downward facing dog pose, the goddess pose, the bound angle pose. So these are about few of them which you can practice very, very safely. Doesn't need much of expertise. And there are different other forms of intensive yoga, and which we take it forward throughout pregnancy, which help muscle relaxation, which help the stiffness, which help balancing, which help the benefit into having a normal vaginal delivery. Yes, these are a certain set of poses like Vakrasana, Utkatasana, Konasana, Prayankasana, Hasta Pranangastasana, so Parvatasana, Bhadrasana, the butterfly pose, Yashtikasana, the stick pose. So there are so many asanas, to be specific, tongue twisting names, but very commonly to talk, like the stick pose, the mountain pose, the cat camel pose, the butterfly pose. These are a little easier on to remember how they are done and all that. So there are different forms of yoga, different forms of asanas, different forms of people making them do the asanas. So it's all about balancing the good, bad, difficult and easy situations. And the only thing that is really important in pregnancy is the safety of pregnancy, a healthier pregnancy, and the outcome of a normal vaginal delivery, which definitely is improved by yoga in pregnancy. When it comes to first trimester, it's a new mom, and a new mom with new hormonal changes and new bodily changes that she's experiencing, like vomiting, headaches, cramps, lower abdominal pain, backache, mood swings, anxieties, sleeplessness, maybe headaches, extensive nausea, vomitings, indigestion, regurgitation, constipation. There are so many things that a mother is going through all suddenly because of the bodily changes and hormonal changes. So it's about dealing with so many things. She needs a promising, counseling that is required to improve her confidence, and not only improve her confidence, she definitely has to concentrate on the good of it. So basically there's so much of information that is available online. People tend to search for symptoms and signs. That is not the way it has to be. First trimester, it's always when you have a symptom, do not search about it. Try to do some home remedies, like having little ginger tea for nausea, vomiting, having smaller split meals, not keeping stomach empty, and eating a little bit of water filled fruits like watermelon, oranges, or these kind of fruits which give additional water intake, and small quantities of food more frequently, and save yourself from constipation and indigestion. Eating right, not eating extra salty or extra spicy foods, and moderate amount of exercises and pranayama. So all these things are very important for women in the first trimester. You are bombarded with lot of information, and you are anxious to know so many things all about pregnancy in those few days, and you get exhausted. So go slow, go smooth, and take your time. Try natural remedies, try home remedies, try remedies that you can do all by yourself. Talk to your doctor, talk to the counselor, talk to people that can give you a lot of boost in your self-confidence, and take things slowly. So definitely first trimester is a little jittery one, but yet you have things, very good things, like listening to the baby's heartbeat, the first look of the baby, and then the good news that comes into the house, all these things. So positive things have to be balanced, and any negative emotions should not get into the pregnancy route. And any doubts, seek medical help. Please do not check online for certain things, because only the doctor knows what is apt for you and what is correct in your situation. That kind of a one-to-one judgment never happens online. So definitely look into the positive aspects, never drag yourself into negative commotions, and first trimester definitely is going to go smooth once you are stable mind and body. And definitely it's good news time, and take care.